Tricyclic antidepressants like imipramine, amitriptyline, and doxepin are going to show up on your PsycNP board exam, so let's talk about them. So tricyclic antidepressants, also known as TCAs, are going to block the reuptake of serotonin and norepinephrine, increasing their availability inside the synaptic cleft. TCAs are an older antidepressant with a long list of side effects, so they're typically used for a second-line agent for MDD. And the long list of side effects is going to include anticholinergic effects, so blurry vision, dry mouth, urinary retention, constipation, as well as antihistamine, so they're going to have sedation as well as weight gain. But more importantly are going to be the cardiac side effects. You're going to have orthostatic hypotension, QT prolongation, and arrhythmias, and it's highly encouraged to have an EKG done before and during treatment. Now let's talk about some prescribing considerations that you should know with tricyclic antidepressants. Number one is the type of people that should not be on here are obviously cardiac patients. It's not going to be good for their heart. They're going to have some type of problem, as well as people with glaucoma or urinary retention. It should also be used very cautiously in elderly people because of the anticholinergic and sedation effects. And if you suspect your patient of having bipolar 2 disorder, don't give this to them because it can cause hypomania. And the most important thing is that TCAs have a very high likelihood of being lethal in overdose. TCAs also have a black box warning like SSRIs where there's an increased suicidal ideation in children and adolescents. And finally, you're going to want to know that TCAs are going to be monitored through blood levels. You don't actually need to know the values for the test, but you need to understand that if you take SSRIs with tricyclic antidepressants, the TCA values are going to be higher, leading to a higher chance of toxicity. And if you take tricyclics with MAOIs, then you have a higher chance of getting serotonin syndrome and hypertensive crisis. If you're watching this and you're a PsycNP student wanting to pass your PsycNP board exam on the very first try, I've created this amazing study guide that has everything that you need to know. Everything I talked about in this video is right here under TCA overview, where I talk about general information, general side effects, prescribing considerations, and key points, as well as all of the TCAs that you're going to need to know for your exam and everything else, including neuroanatomy, DSM-5 criteria, scale, psychotherapy, defense mechanism, and much, much more. So if you guys want to check this out right now, I have it for 50% off. Check out the link in my bio and let's get you board ready.